Massive changes are to be implemented to the UK immigration system in the next coming year. Now, pandemonium erupted last week when a white paper was published by the government, specifically the Home Secretary Yvette Cooper, who detailed the measures in which immigration will be strengthened in the UK. Now, the group that is most affected by this includes care workers. Now, if you're a care worker, a healthcare assistant, a practical nurse, or a nurse interested to go to the UK, this video is for you.
I'll tell you some of the things that we're setting out this week. So we're going to introduce new restrictions on lower skilled workers, so new visa controls, because we think actually what we should be doing is concentrating on the higher skilled migration, and we should be concentrating on training in the UK. Yeah. New requirements to train here in the UK to make sure that the UK workforce benefits, and also we will be closing the care worker visa for overseas recruitment as well. So,
when will these white paper recommendations actually come into effect?
Well, that is a good question, and one that we've been trying to get the answer to. Some of it will need what's called primary legislation, so it will have to go through all stages of the House of Commons and the House of Lords. Something to do with the European Convention on Human Rights, for example. There's going to be some clarification around that. That would need primary legislation, so it could take quite a long time. The changes to care visas, those changes, we're told by the Home Office, will come in June. The significant change in the way that you get indefinite leave to remain, the change from 5 to 10 years for qualification, you have to be here, you're going to have to be here for a lot longer. We're being told that that is going to be out for consultation, so we don't have a date for that one, which I'm sure will impact a lot of people. And then there's a new levy, a new tax effectively on overseas students. That, we're told, the details of that will be in the autumn budget.
So last week, the white paper was published. And before we go into the video, I want you guys to understand that a white paper is not basically law. It's a proposal to a solution to a problem. So they're proposing a solution with regards to reform of immigration towards the United Kingdom. Now, being an international nurse myself and being in the international realm, studying various countries and watching their boards of license, boards of nursing, and how immigration takes place across the world, I can say that countries such as the UK has been a country for me that, based on my understanding, has been a bit more easier and lax in terms of immigration. No pun intended, right? Now the UK has taken measures to decrease the amount of persons that are coming there and to make restrictions. Now, as you can see on the thumbnail that was listed before, we spoke about care workers. Before we dive into the video, I want to show, we dived into that video and we saw what the Home Secretary of State talked about. Now, let us do a little understanding for persons who may be living outside of the United Kingdom and not understanding what the care sector is and who are care workers. Now, the care sector includes that of our healthcare workers, specifically healthcare assistants. Healthcare assistants, similarly, we can bring it back home to Caribbean, African areas. These are called your practical nurses or healthcare assistants. They work with your nurses and they are termed healthcare assistants. And if you did not know, yes, there is a country that you can migrate to that will take your credentials and your qualifications if you only are trained as a healthcare assistant or a practical nurse. Now, over the years, many practical nurses or healthcare assistants have taken this route to migrate to the United Kingdom, and it is called your skilled worker route or the skilled worker visa. With this visa process, it's quite easy. It takes a little bit as much as 6 months before you can migrate to the United Kingdom, and yes, you can take your dependents with you, including your family. Your work is tied to your sponsor, and you work back for your sponsor for about 5 years, and then you are entitled to apply for citizenship. Now the UK is implementing measures with regards to this to pose a restriction and possibility a ban, which is expected to take place with this government proposes the white paper and it is pushed into law. They will see an end to the care sector reform. They will actually see an end to the care worker visa come 2028. Now, when this paper was published, it saw a major uproar. A lot of persons were in the discussion. You saw videos circulating all over TikTok, YouTube, BBC News, you name it. published all over speaking with regards to this. Now, what is the big issue with regards to this? The care sector relies heavily, based on my understanding, on international staff. Many persons, especially those who run nursing homes, often rely heavily on international recruitment. And if the government is proposing an end to this recruitment, this will force business employers to look elsewhere, and that's what the government wants. Employers will now be required to prove that they have searched within the United Kingdom to find workers, and they now have to look outside. Now, if they do not do this, they will face significant consequences. Now, the major areas to be affected by this proposal of the white paper includes that of skilled worker reform. They're looking at bringing more qualified, increasing the qualifications that it takes for individuals to go to the United Kingdom. Extended residency requirement. This is a big one. They're now saying that no longer will you have to work for 5 years within the United Kingdom before you apply for citizenship. It will now take 10 years. Now, English language requirements will be mandatory, especially for your dependents. So if you're migrating, whether you're a wife or a husband, taking your family, everybody in the family, including wife and husband, will have to take the English language test, preferably commonly called the IELTS. So we're going to dive into an article that was published by the Nursing Times, and it entitles "Government to Ban Overseas Care Worker Recruitment." This was published last week, May 12, 2025, and it was written by Ella DeVerx. I hope I pronounced your name correctly, Ella. Now, in this article, it spoke about overseas recruitment of care workers will end by 2028. On the plan set out by the government today, ministers have unveiled controversial changes to visa and recruitment laws in a bid to cut net migration to the country. Nursing unions have come out and criticized the plans, describing them as pandering and scapegoating. The government said that the new measures set out in the immigration white paper will put an end to overseas recruitment across social care sectors. Now, this paper comes as net migration has been climbing in the United Kingdom. They have recorded 906,000 migration in the month of June 2023, and last year it stood at 728,000 who migrated to the United Kingdom. The white paper noted that the expansion of the health and care visa route, which is the route that the care workers or practical nurses take in 2022 to include care workers, led a sharp increase in immigration via this route. Now, in 2022, around 37,000 people came to the United Kingdom via this route, which led to 108,000 in 2023, it said. Now, you can see why the government wants to put an end to this. Finally, the UK saw an increase in visas for dependents, meaning that you can take your children and your partners with you of who were coming to the country via the social care route. The announcement comes as the government has been taking measures to clamp down on rogue care providers that exploit overseas staff, as well as other changes to social care recruitment. Not only that, it has caused a mass migration via this route. Many have complained about abuse and exploitation once they migrate under this route. I have heard stories too, saw nurses or care workers speaking about the limited the lack of pay that they receive. The pay is not competitive, and not to mention that exploitation and abuse. Many have even noted that they went through this route, and when they showed up, there was no job and they were left on their own. Now, the Chief Executive Officer or the Chief Executive of the Royal College of Nursing, and also Professor Nicola Ranger, the General Secretary, made a statement with regard to this proposal. She spoke to the nurses saying that they are more than welcome to come to the country, and many of them started out nursing very far away from home, and we all know the obstacles that they endured. And she called out the government as making such policies such as pandering and scapegoating. Now, she is calling for the government to stop playing a game like this and set out several demands to improve the experiences of overseas staff. So she's asking for better implementation of policies. Now, she also asks that nurses to not be affected by this, especially healthcare workers, in terms of citizenship, to make them exempted from the 10-year requirement of staying in the country, which I believe also. Now, that is the end of this article. I will have it up here and you can read it on your own. Now, with regards to this entire new policy, a proposal, and when I saw it, it was quite alarming to see it in terms of creating a restriction and probably banning the social care route. But I can safely say that I literally saw this coming. Working in this area and practically doing some business with this country already, I saw this coming in terms of limiting the number of international nurses or care assistants that came to the country from outside. I think this was a wonderful move in terms of the pathway that they have created, and I can add to that I have literally seen firsthand abuse and exploitation of this route, and I'm calling for greater regulations to be made, but not to end the system, but this is their country in terms of what they want to do, but tightening up the system in terms of the qualifications, and also making sure that when individuals go to the country that they receive fair pay and livable wages. Now, with regards to this, we saw some changes in terms of citizenship, changes in skilled worker reform, and also English language requirement. Now, if the UK is not careful, they may end up suffering in the end, because many countries, first world countries across the world, will rely heavily on international recruitment. Why am I saying that they need to be careful? Now, if you create restrictions and even cut out an entire route and say that nurses or healthcare workers will have to wait 10 years working and living in a country for 10 years before you get citizenship, persons are going to choose other countries such as United States or Australia or I think New Zealand, that gives you permanent residency once you enter the country. So we have to be careful on policies that we make. Yes, we want to decrease it and curtail the amount of persons that were coming, but be mindful that you may end up cutting yourself short. I have read articles across various sources seen where they are actually saying that many international staff are using their country as a launch board, meaning that many of them do not stay after they get citizenship or even before they get their citizenship. And my thing as a nurse is, if you want nurses or your healthcare personnel to stay and work within your country, treat them better, pay them better, provide safe environments, limit toxicity in the workplace, provide proper career progression for them, and one thing that trumps everything, provide livable wages. Then you won't have persons using it as a launch pad to go to other countries. Yes, this care worker reform route or skilled care visa existed many moons ago, but I can say that countries that are on the Eastern Hemisphere were more privy to this and knew about it. I don't know if much of us knew about this, especially on the Western Hemisphere, especially Caribbean. Yes, there was a skilled visa route that you could take, even bringing you and your family to go to the United Kingdom under what we call skilled visa route. And this allows you to work in the care sector, work in nursing homes, or even working for the NHS, which is their similar to Jamaica Ministry of Health, working in a hospital system. Within the space of 6 months, you could migrate to this country with your family and work and live in the UK until it's your time for your citizenship. And you have the ability to also fly back home on period occasion once you're granted leave or anything. Now, many persons have had interest in going here and were waiting for something like this until more opportunities were seen. Already we're seeing a decrease in the number of international nurse openings, whether for the NHS or for care sectors. Lots of decrease in that, not much openings, as it has become harder for employers to recruit outside. All I can say to you guys that immigration policies changes like this, a snap of the finger, and immigration is tightening up all across the world. If you're watching the news, you can see carefully that various countries across the world are tightening restrictions. There will be still opportunities, but guess what? Start looking at other countries, right? So as we stated before, don't be dismayed. There may be other countries that may accept your qualifications, and let's see what the government will do if they will literally propose this white paper. Now, I know that many of you have reached out to me in terms of using or applying for this route, and I myself was working with this, but we had to pause because guess what? We saw the decrease in openings and we saw that the demand was on the low.